Right then, good morning everybody, and well, I would normally say welcome to the University of Birmingham, but we're welcoming you virtually this time. So, as I say, welcome to the University of Birmingham's talk on dentistry, and this is about the programme rather than the admissions requirements for this stage. So, what can you expect from the talk today? Well, my role is, as it says on the screen there, is a senior clinical tutor in restorative dentistry, which means I teach the students on the clinics, and I'm also heavily involved in the education side as well as admissions. So I can give you a bit of information about what it takes to be a dentist, the career opportunities, and really a little bit about the course at Birmingham as well. All of the pictures that we're going to show you within the slides today are of our dental students within the course. They're of the facilities at Birmingham. So although you can't get a chance to actually go around the school physically at the moment, it does give you a little bit of insight into how the building looks and how student life is within the building. There is a video or a sort of virtual guide on the website as well, which gives you a little bit more information about what the school looks like. And obviously we hope to give you an opportunity at some point in the future to come down and see the school when conditions do allow us to do so. So one slide that actually appears in both of our presentations is this one here, and it's something that really rings a lot of truth about dentistry. So a dentist has to be a doctor. We're there diagnosing conditions. We then have to engineer solutions. And then we actually have to then carry out those solutions as well. And for that, a lot of dentistry now, particularly in restorative dentistry, where we're putting things back together, requires a level of artistry, because you have to create the same shapes and forms of teeth that we had before. So it's a very apt slide, that one. So dentistry can be a fantastic career, and it can be a very varied career as well, but you have to be the right person for the job. It's quite stressful. You have to be good at working under pressure. You have to be resilient. Lots and lots of things come along. The situation right now is a prime example of that. And you have to be able to deal with that, the stresses and strains of both undergraduate life and in practice as well. I'm sure you've all been reading around the news and looking at the sort of dental and medical aspects of the COVID situation. All of our dental students had to leave the building in the middle of March when the lockdown occurred, and haven't been able to go back since. And dentistry in general practice as well has had to stop, because unfortunately one of the things that's come out from this is that dentistry is probably one of the most high risk areas with the aerosols generated. So obviously we're looking at different processes about how we can put that back together, but it is causing a lot of stress for both our students and also our practitioners out there at the moment. Obviously that's going to be resolved in time, but it is something that was very unexpected. So what does a dentist actually do? Well, there's lots of different specialty areas within dentistry, in the same way as you have specialty areas within medicine as well. So you often go to your GP in a medical environment, and you might get referred on to a specialist at the hospital. And we have the same sort of situation in dentistry. We have our general practitioners who will see and look after patients and their families. And then we also have areas of specialty interest. And as a dental student, you're going to get trained in all of these specialty areas up to what we would call a safe beginner standard. So the standard that you could go out and work independently in practice. There's a list of specialty areas there on the screen. It covers everything from children's dentistry through surgery, through the special care type of dentistry, the big realm of restorative dentistry, as well as the sort of maybe slightly more fringe subjects, but certainly equally as important, such as public health, microbiology, and radiology and radiography. But as you can see from the list on the screen, it is very, very varied. Most of our students will qualify and go into a general practice background where they'll look after their patients and they'll focus in sort of modern dentistry on providing general dentistry, prevention or hygiene advice, and looking after patients' families. And that's really very, very rewarding. My background before I came back into academia was in general practice, and you get to know patients as they grow up. You see them almost being born, and then they come through when they're getting their first few teeth, and ultimately you can see them right into adulthood as well. And seeing that journey is very, very rewarding. And all through that time, you are giving them advice, diagnosing, treating, and reviewing them and getting to know them as well. Different career opportunities are general dental practice is the main one. As I said earlier, majority of our graduates will go into general dental practice, and that's your typical high street dentist. But other than that, you've got other areas such as community dentistry, particularly in the bigger conurbation areas such as Birmingham. We've got a lot of community outreach clinics, and our students will actually go into some of those outreach clinics as well as part of their training. Hospital dentistry, most general hospitals will have a big general dentistry department where they carry out some specialist dentistry, and obviously the dental hospitals as well, the main focus of that, but there's only dental hospitals in the bigger cities around the UK. Armed forces dentistry is something that's often overlooked, but it's very, very important, particularly if you are considering a career down those avenues. It's worth engaging with the armed forces quite early on, because they will be very, very supportive of you during your career as both an undergraduate and in the initial years after graduation, particularly financially supportive. And then finally, we've got the university dentistry. University dentistry is often cited, or majority of cases are cited within the dental hospitals themselves, but it does extend into the outreach clinics as well, so it's a bit of an overlap between both community dentistry and hospital dentistry. Ultimately though, everything is to do with teeth. So what are the career expectations? Well, as I said earlier, general practice is where the majority of our graduates will begin their careers, and they go into something called foundation training. This has changed nomenclature over the years. It was vocational training, so 20 odd years ago, but it's developed into a more formalised year after graduation, where our graduates are supported by a practitioner who's experienced, and they undergo a formal training programme for that first year. Where those places are does actually just depend on where the dental need is at the time. So it does vary, and there are different numbers of places in different areas. And it's a competitive process where our students in fourth year will start to think about applying for those for the assessment, and then in the early part of the fifth year, there'll actually be an assessment to rank them, and according to their ranking, is where you get your first choice of placement. However, ultimately, there is 100% employability for our graduates. So there's a vocational training or foundation training in place for every single one of our graduates. So there's no real worry about dentistry not leading to an employed career afterwards. Why are dentistry places so difficult to obtain is a frequently asked question, and we are restricted by the number of places that we're allowed through government funding. We also have particular pressures. We have to think about the number of dental chairs that we have. We can't just suddenly increase those. And obviously the building in Birmingham is very, very new and was designed around a certain number of students. So not only are the dental chair facilities built around those numbers, but also the other facilities that go along with them. So hopefully you can see that there's a lot of constraints that are put on us, and it isn't as easy as just adding in extra places. Got some pictures coming up now of the clinics and the new dental hospital in Birmingham. I mean, one thing that really is worth stressing though is that this is the most modern dental hospital, dental school building in the UK. It's the only new building that's been built in the last 50 years. and it is really cutting edge in terms of the facilities, the design, and the layout of the building. Where it's sited is now much closer to the campus. Originally, the old dental hospital was in the centre of Birmingham, a little way away from the main campus area. And the campus is certainly a lovely place to be, as well, as you can see from the picture of the clock tower there. The clock tower is actually visible from the 3rd floor of the dental hospital through a frame window. It's an amazing view across, straight across into the campus. So we're sited about 10 minutes walk away from the main part of the campus now. In the picture at the top, you've got one of our final year students who is discussing a case with one of the tutors, and this would be the sort of typical environment on clinic where they would be seeing their own patients, but they would come along and discuss cases with their tutors. So could this be you? And here we've got another picture of one of our undergraduates working with a trainee dental nurse on a patient. You have to remember, in dentistry, this is where the big difference is over other courses and even over medicine. Our students are given a huge amount of responsibility and are actually carrying out operative dentistry on real patients, which is really exciting as well. So why come to Birmingham? Well, as I said earlier, the main selling point, I think, is the facilities. We've got the newest dental hospital in the UK. It's now also virtually on campus, so it's very accessible to the accommodation area in Selly, but also to the main part campus. Campus as well is a fantastic place to be. The University of Birmingham is investing huge amounts in developing the campus facilities. The new sports centre, for instance, is a world-class 50-metre swimming pool and gym. It's only just down the road from the dental hospital. We're also one of only 2 UK schools in the top 20 globally, based on research, and 3-star, 4-star might not mean too much to some of you, but essentially that's the sort of top ranking research. Is the research that has global impact. And right now, at the moment, we're carrying out some studies looking at antibodies around COVID as well, within the dental hospital. We employ a variety of teaching methods and styles. All of our staff are very friendly and approachable. A lot of our staff are trained in Birmingham and have come through the system and are very supportive of Birmingham as a university. We also pride ourselves on the teaching ratio, as well as the fact that our students work predominantly in the clinical years on their own, rather than in pairs. It means they get a lot more clinical experience than some other schools. We also have a huge amount of specialist input as well, both from practitioners and from our clinicians within the building. And ultimately, it's a great society to be in, and our students, particularly when they graduate, will look back with fond memories of Birmingham. Again, a few more pictures of some of our students. We've got these areas away from the clinics, which are bottom left-hand side is our learning zone or learning hub, where our students will be able to look and review cases as they are in the picture there, but also they've got access to the library and the resources, as well as the other pictures there of the laboratory settings, where they'll be working in world-class facilities in simulation, looking at getting their initial experience working in a simulated environment before carrying out those procedures on clinic. Another picture of one of our groups. This was actually the group of students that I taught a couple of years ago. They've now just graduated this year, so all of our students in the current final year have now graduated. So it's a 5-year course, and it can be broadly broken up into two main areas, the more preclinical and the clinical, but we have this section in the middle between the two, where we transition our students from that preclinical environment of learning about biological sciences and integrated health sciences So it's starting to develop those practical skills, working in simulation in the introductory clinical terms before finally becoming a clinical dental student. And as I said at the beginning, with the aim of graduating our students as a safe beginner. So these areas of the course are merging more and more together. We are looking at getting much more in the way of early clinical contact for our students. That's a reactive change to what students are asking for, but also what other schools are doing as well. But doing that as well has allowed us to sort of reevaluate our curriculum and to really highlight the dental relevance as we go through the course. Our students and staff also participate quite freely within this Birmingham Dentist blog, which is run by one of our staff members. It keeps people up to date with what's going on within the school, highlights their achievements, and really showcases some of the events happening within the school. Taking a gap year is something that we're asked about occasionally, and this is generally considered positive. You've got two options during this. You can either apply before you go and then defer the place for a year, or you can apply during that year, and that's often a good idea if you perhaps didn't get the GCSEs that you required, allowing you to sit those A-levels, gain the 3 A's that you require as our minimum, and then apply to us with those achieved A's. And if we then accepted you after an interview, because you've already sat your A-levels, your offer would be then unconditional. The other thing that we just need to cover, something that's mentioned in the other talk as well, is what about work experience? And we appreciate it's going to be very, very difficult at this for this year coming up. But it is there just to gain an insight into what's going on in practice and what a practice career is like. Because as I said earlier, most of our graduates will end up going into a general practice career, but also our graduates, our dental students will be carrying out effectively general practice during their training. So it's important to just understand what that entails. However, as I said, we do understand that this is going to be very, very difficult this year. Again, work in society is there just to show that caring side. Our students have to deal with patients day in, day out, and having good communication skills and being able to understand the good and bad things perhaps in society is a real important point. Our interviews will be undertaken generally in February in the half-term week, but we obviously this year are going to have to change that a little bit because of the situation. At this stage, we'll discuss this more in the admissions talk, but at this stage, obviously, we are still looking at different ideas and plans. But ultimately, our main goal is to look for prospective students that meet our requirements for having good communication, as well as having good manual dexterity skills. So our stations are broadly centred around those particular skills. Few non-academic requirements that are also mentioned in the other talk. Our students are carrying out operative procedures on patients, on real patients, same as they would be in practice. And because of that, it's considered an exposure-prone procedure course, an EPP course. And for that, we just need to make sure that our students have the required immunisation and everything's in order there to protect them as well as the patients. Equally, a DBS check is a requirement. The other things worth mentioning are that we also have other requirements such as adhering to infection control. This is a little bit perhaps out of date in the current situation because requirements for PPE and requirements for infection control are changing almost on a daily basis. But the expectation is that our students are required to adhere to the standards and the protocols set by the Birmingham Community Healthcare Trust, which is the trust with which the dental hospital sits. But generally, prior to COVID, we were looking for bare below the elbows dress code to give protection to both yourselves and to patients. There's a lot more information available on our website, and we're here to answer questions during the day, both in the student hub as well as within the talks. There's also the chat facilities. And then, as I said, we have a website with information, and also we have other information that we can give you through our dental admissions email address as well. The main team are myself and Joanna, who is the admissions tutor, the head of admissions. Frances is probably the most important person in the team, because she knows so much about the admissions process, working in it for so long, and can answer most of the questions. But anything that she can't answer, she can flag to one of us. So thank you all for listening, and I think we're going to have a little bit of a talk now from Dylan, who's perhaps going to give you more of the student perspective of the course, and what life is like in Birmingham. But Birmingham obviously is a fantastic city, as well as having a fantastic university. Other big events are coming up very, very shortly. 2022, for instance, there's the Commonwealth Games, so there's a lot to look forward to from being a student in Birmingham. I'll hand over to Dylan just so that he can give you a little bit more of an insight, and I'll stop sharing the screen so that you can see him in the full screen.